The American Association of Colleges of Nursing's website reports that a shortage of nurses is expected to occur due to both an aging baby boomer population and the lack of expansion in college nursing programs. This lack of qualified nurses has severe implications for the overall quality of medical services and health of patients in the United States. In his 2009 study on the relationship between the number of nurses and the mortality rates among cardiac patients, Dr. Vanden Heide noted that when the total postoperative in-hospital mortality was studied according to the place of death, it appeared that the highest percentage was found in postoperative intensive care units, 67.9%, followed by other units after the stay in general postoperative nursing units, 21.3%, and postoperative general nursing units, 10.8%. Vanden Heide's research demonstrated that higher mortality rates can be attributed in part to the lack of qualified nurses. Other studies have demonstrated that a lower patient-to-nurse ratio improves the outcomes and quality of health of patients. One of the most critical areas in need of nurses are cardiac wards that deal with postoperative heart surgeries as well as other heart-related issues. Many studies have shown that patients who are ambulatory and begin exercising soon after cardiac surgery return to postoperative lifestyles quicker and have a better outcome than patients who remain immobile after surgery. With a critical shortage of nurses, many researchers are exploring the possible use of robotics and androids to allow hospitals to provide services for their patients. Other researchers have examined the effectiveness of robots in accessing patient rooms and performing functions like lifting and carrying, and have found them to be beneficial for future use. Our research will continue this look at the effectiveness of including robots into the practice of medicine by examining their effectiveness in helping postoperative cardiac patients regain their strength and overall health quicker than patients who do not utilize their service. Our claim is that a robot will be more effective in assisting cardiac patients during the initial postoperative phase, in which they regain mobility and need to begin exercising to improve overall health and outcomes. In other words, a robot can be an effective means to motivate and assist a cardiac patient in performing basic exercises, such as walking, in order to reduce postoperative health complications. In a large metropolitan hospital, postoperative cardiac patients will be randomly assigned to a robot-assisted exercise treatment program. The treatment group will receive their recovery assistance via the cardiac assisting robots. The control group will receive the standard treatment via a nurse only. All participants will be over the age of 18. Our plan is to conduct our trials with at least 100 postoperative patients within a 1-month period. The data collected from the participants will include the length of stay in the hospital and whether they are readmitted to the hospital due to complications within the next 3 months. A survey will also be conducted among the nurses and patients to assess overall health of the patient and the receptivity by the cardiac ward staff. We will use a quasi-experimental design that will include a post-test only control group design. As mentioned before, our patients will be randomly assigned to a group, and one group will have the inclusion of an assistive robot during recovery to encourage mobility and exercise. The other possible assignment is to the control group. Control group patients will receive the current standard treatment for post-cardiac patients, which is human-assisted exercise routines. The post-test will be the previously mentioned data collected from the hospital. The independent variable will be inclusion of an assistive robot to encourage mobility and exercise. The dependent variables include shorter postoperative stay, better long-term health outcomes, and increased attrition rate in post-discharge ER visits. The data collection will be administered by the nurses and hospital administration staff. Nurses will document 2 types of data and then will administer a survey 3 months after being released from the hospital. The nurses will also take a survey themselves. In addition to the survey, 2 types of data will be collected. First, the length of the patient's stay in the hospital, and second, the amount of times the patient was readmitted to the hospital in the next 3 months due to complications. The data will be collected at the hospital and kept in the nurses' logs. Once we've randomly assigned a patient to the treatment group, they will start receiving robot-assisted exercise therapy. The robot that will be used to assist the patient is a variable speed, statically stable, non-manipulable mobile platform that can either be programmed to follow a planned route or be operated by the patient using a simple video game-style joystick. The robot frame will consist of a Segway, multi-directional base, capable of 360-degree turns with multiple adjustable hard points for patients to grasp. The robot will be equipped with sensors to detect motion as well as proximity to objects for safety purposes. A GPS and accelerometer device will allow the researcher to track location and speed. The robot will need to be able to carry IV bags, heart monitoring equipment, and be outfitted with an emergency nurse contact system that can alert hospital staff in the case of a cardiac event. The robot will also need to have a patient-controlled braking system as well as an emergency override system, manual and Wi-Fi, in the case of an emergency. The patients that will receive the treatment are those who are randomly assigned to the treatment group. They are assigned as they are leaving surgery. They will receive assistance twice a day, once in the morning and once in the evening. Treatment time will vary based on the needs of the patient. An independent sample t-test will be used because the patient's hospital stay time and the amount of time the patient returned due to complications within the 3 months has an interval that can be measured. The t-test will determine the statistical significance of both the hospital stay and the days returned, independently of each other. The statistical significance will help determine if we can reject our null hypothesis that using a robot to assist and motivate patients to walk shortly after cardiac surgery would have no effect on the overall outcome of a patient. We expect that the data will show that not only the duration of the stay of the patients will decrease, but the patients will also have dramatically lower return rates due to complications. One of the potential threats to validity could be that once other patients see certain patients using the assistive device, they may want to also use it, and nurses, desiring to be assistive, may give in, thus reducing the control group size. This may not be the case, but it should be part of the training process with the hospital staff. Another potential validity issue is that older patients may not be as receptive to using this type of assistive device. Also, we need to consider the human effect. Perhaps it is not simply the increased mobility that helps patients, but the social atmosphere that surrounds the act of walking. We should consider socio-cultural issues like this. The goal of the study is to show that a robot can be an effective means to motivate and assist a cardiac patient in performing basic exercises, such as walking, in order to reduce post-operative health complications. We expect that the program will work smoothly over a 5-month period. 2 months of assisting patients and allowing them time to recover in the hospital, with the final results received 3 months after the patients are checked out from the hospital. Our hypothesis about the finding is that the use of robots will dramatically reduce the amount of post-operative health complications that occur due to the lack of nursing staff in hospitals.